Pertussis, or whooping cough, is caused by the bacterium Bordetella pertussis. It spreads through droplet infection, primarily via coughing and sneezing. The DPT, divided by DTaP vaccine, part of the National Immunization Program, controls pertussis. Pertussis, or whooping cough, progresses through three distinct stages: catarrhal, paroxysmal, and convalescent. Diagnosis involves nasopharyngeal swabs for culture and PCR testing, along with blood tests showing lymphocytosis. Treatment includes antibiotics, supportive care, fluids, rest, oxygen, and isolation during the infectious period. Pertussis prevention primarily relies on timely immunization using the DPT divided by DTaP vaccine. Early diagnosis and treatment of pertussis cases and their contacts are essential for control. Community health nurses actively identify cases, educate on vaccinations, and manage cases to curb spread.